So this week, we confirmed a third case of the measles connected to an international flight.
That's right. One was a breakthrough case in a vaccinated adult. That's surprising. To answer more of our questions, we bring in, of course, our 9 News medical expert, Dr. Payal Kohli. Okay, Dr. Kohli, that surprised me because how common is it for a vaccinated adult when they're exposed to actually get measles?
Yeah, it's pretty uncommon. In fact, in our recent outbreaks, over 90% of cases have been in unvaccinated or under-vaccinated individuals. The vaccine works really, really well, but it's not perfect. And so if you have 100 people and you've only gotten 1 dose of the MMR vaccine, 93 people will be protected and 7 people will be susceptible, so 93% effective. If you've gotten 2 doses, 97 people will be protected and 3 will be susceptible. So we don't know this individual that actually got infected, whether they had had 1 dose or 2 doses. And also whether it was the MMR vaccine or a different vaccine, because between 1963 and 1968, we were actually using a different measles vaccine that wasn't as effective.
So it you do need to check with your doctor. I know we've been talking about this for a while with these measles outbreaks, of what year you got it, and maybe if you need a booster. But I always think of this flight, like an international flight, 1 person sick, and that's a cabin, right? A lot of people exposed. Yeah. So anything you can do. I mean, also we're hearing about the fact that this child, the unvaccinated child that got sick, that child was at multiple places, including an ER and a grocery store and all these different places. What can you do?
I mean, it's in a little incubator, Kim. Like you said, it's the most contagious infection that's out there. If you're sitting on a plane with somebody that has it, in a movie theater, in a grocery store, in an urgent care, in the waiting room, I mean, the risk of being exposed is really high. And your immunity could have waned over time. So the reasons why the vaccine fails, one, is never worked in the first place, very rare. 2, your immunity waned, which is also pretty rare with measles. If you've been vaccinated, usually it's lifelong. But 3, there's too much infection around you, right? And so the immune system just gets overwhelmed. So if you've been exposed, I would say here are a few things to do, and the CDPHE says this as well. 7 to 21 days is that key window where you're going to monitor for signs and symptoms. After 21 days, you're basically in the clear. You know, fever, cough, that rash that starts on your face and sort of spreads down. If you've been vaccinated, your infection is likely to be mild. So don't blow something off just because you're feeling under the weather. Isolate yourselves from others if you've potentially been exposed, because the last thing you want to do is make a child or a pregnant woman or somebody else sick.
An older person.
Yeah.
Well, mostly children. I keep thinking of these kids.
I know. Some of them that are too young.
Yeah.
Now, you mentioned, okay, if you're exposed, this is what you do. If someone's exposed, can they go and get an MMR vaccine or a booster while they've been exposed?
Yes, and that's the key here.
Oh, I do that in a minute.
Yeah, that's called post-exposure prophylaxis. But your window is only 3 days after exposure to really get that vaccine to help it work. And it does 2 things. One is it makes it less likely that you're going to turn positive. And the second is that if you do turn positive, it makes your illness milder. So that 3-day window, if you've been exposed, you might want to go and get post-exposure prophylaxis. Now, if you're immunocompromised, pregnant, or past that 3-day window, you can actually get antibodies as well. That's called IVIG. Remember back in COVID, when people were getting sick, we were giving them antibodies. That's passive immunity, as opposed to active immunity, where we give you the vaccine and your body mounts the response. But for some people, like pregnant women and immunocompromised patients, they can't get the vaccine because it's a live vaccine. And so we actually would have to give them those antibodies, or infants under the age of 6 months, in order to protect them from the infection.
Okay, well, now I'm going to ask kind of a stupid question. So because this kind of always makes me nervous, whenever you go to an urgent care or anything, or even like grocery stores and things like that, and I'm always thinking, take my sanitizer. Does it make a difference to really do that right away, or wear a mask? I mean, should we be doing things proactively, saying this is out there?
Yeah. And doesn't it stay in the air really long?
So that's the problem with measles.
It's going to say measles isn't that way, right?
So you can be gone from the space for 2 hours, and it can linger for up to 2 hours afterwards if you coughed. So you don't even have to come into direct contact. Now, of course, it is a respiratory virus. So if it lingers on a surface, you touch it, you touch your face, your hands are not clean, you're on a plane, what have you, that's still important to do. Hand hygiene, important to. The N95 is what you need if you really want to protect yourself, not a surgical mask. But again, because of the airborne nature, sometimes the person's not even there. You came there after they left and you could potentially be exposed. So I would say the best way to protect yourself is that vaccination. If you're not sure whether you've had 2 doses of the MMR, which a lot of us don't really know because we got it when we're 1 year old and 4 to 6, then there's a few things you can do. One is you can ask your doctor to check your antibody levels. These are called titers. It's a blood test that basically confirms that you have enough antibodies against the measles virus. Or you can go and get a second booster. And it's not necessarily going to be a bad idea. It doesn't hurt you to get one, except if you're pregnant or immunocompromised. So make sure you check with your doctor that it's okay for you to get one. But it might not be a bad idea to give your immune system a little boost, especially if you're thinking of traveling abroad, because the travel in other countries, if you're going to go to an area that might have a measles outbreak like Texas, or if you're a healthcare worker that's potentially exposed to people that have measles.
I think a lot of people are going to go get that. Okay.
I hope so.
And get the test too. That's
Yes,
good.
and
That's
like
good.
I said, if you're born before 1957, you've probably had the measles, so you don't need to worry. 1963 to 1968, that's that high-risk period where I would suggest you go talk to your doctor. And then after 1968, just make sure you've had those 2 doses.
Okay, as always, things to think about in the summer months when people are moving around. You can find out much more from Dr. Coley at 9news.com/Dr. Coley.